So with the African peer review mechanism set to launch its report on how AU member states respond to COVID-19, former strategy and planning advisor to the AU Commission chair, Febe Potgieter Gqubule, says Africa has a good track record. Now the continent, as you know, has experience with epidemics like Ebola, and this does stand the continent and its countries in good stead. Gqubule was speaking at a webinar on Africa's response to COVID-19 and the lessons learned through other outbreaks. She joins us now via our Zoom line to unpack this story. Febe, thanks very much for your time this morning. The biggest health emergency of our time, those were your words during that webinar just yesterday. How is Africa at an advantage? Let's start on a positive note.
Well, I think that Africa accounts for a large part of communicable disease deaths in the world, up to 50%. We've 4 years ago had the Ebola pandemic in West Africa. We have and still dealing with malaria. We're still dealing with AIDS, HIV and AIDS and tuberculosis. So I think that in a sense, the health systems are geared towards that. At the same time, there are lots of challenges. And I think that what we now see is that African countries have learned from previous pandemics to be able to respond to the current pandemic.
And the issue, as always, does lead us back to a lack of funding, perhaps, or a gap where there should be funding. And also, what COVID-19 does is it reverses some of the gains that have been made over the past decades.
Absolutely. I think I mean, the obvious reversal of the gains is on the economic front. So what we see is the slowdown of growth. For example, take a country like Ethiopia, their flour industry, which has become a major exporter, also Kenya, because of the drop in demand, that is facing serious crisis. Ethiopian Airlines, South African Airline, Kenya Airline, Egypt Air, and other African airlines, similarly, because of the closure of borders and the impact of COVID-19 on travel, it means that countries are affected. And then, of course, the collapse of the oil price as well have impact on oil-producing countries. So I think that that's one part of the impact. That countries felt and reversing those gains. The second one is that the response from previous pandemics tended to be that, for example, of Ebola 2014-2016 so overwhelmed the health system that people then don't pay attention to other pandemics. And what you then find is that, you know, there's a drop in malaria treatment. Children don't get immunized because we're fighting a particular pandemic. And I think that one of the lessons from the previous pandemics is that we need to focus on not just the current pandemics, but also ensure that we have treatment. And I think in South Africa, we see that over the last 2 months or so, people not turning up for their TB treatment, people on ARVs not continuing with their regimes. And I think that's one of the lessons that we need to learn and not repeat the mistakes.
Speaking of lessons that we would have learned, you know, in the past, in our handling of Ebola, in our handling of HIV and AIDS, and a number of other health issues here in South Africa and across the continent, do you think that we are taking those lessons and we're applying it here during this current pandemic, COVID-19, and we're doing it successfully enough? I'm just thinking of, you know, with Ebola, most of the infections during that time came from funerals, and now we're having the same discussion around allowing funerals and religious gatherings to happen under certain conditions. But have the lessons there not been learned already?
I mean, one of the challenges, and I remember at the time, the then president of Liberia making the point, President Sirleaf Johnson, that part of the reason why you have to have, together with the efforts by government, you also have to have social engagements with faith-based organizations, with communities, is because it touches on quite deep cultural and that we all practices that we all part of. For example, funerals in the 3 countries, people went into Ebola treatment units. Next time the families hear about them, it's a message that they've passed on. They're not able to wash the body as they do like before. The family can't have their vigils. there are strict protocols around burials. And I think that is why local government, and I know that a number of local government have developed guidelines for mortuaries, for faith-based organizations, people dealing with funerals, to be able to say that. But I think that we also need to look at how do we, in the past on Generations and other TV shows, we had people walking on, or we had enactments of issues around HIV/AIDS. And I think that we need to have the same in our soapies today, so that we have public education about the very difficult human issues that the pandemic forces us to do.
So I suppose the question, Febe, is whether COVID-19 could be the catalyst for a better Africa. Here at home, communities have spoken to us about the fact that for years, many years, they haven't had access to clean water. Now, in the wake of COVID-19, a lot is being done to get tankers, even though it's a temporary solution. It's some sort of solution which we haven't seen in the past years. Do you reckon that this might be the spark that we need that ignites real change here in South Africa and across the continent?
Well, it's certainly for South Africa, it presents a great possibility. And the same for the rest of the continent. For example, we have the Abuja Declaration of the African Union called for governments to increase expenditure on public health to 15% of budget. At the moment, there's about, I think, 6 or 7 countries of the 55 AU member states that have reached that target. So I think that the importance of investing in public health, and particularly primary health care, may be one of the very difficult lessons that we learn. The second one is to also address the social dimensions of health. Water, sanitation, overcrowded housing, pollution, smoking, and all of those things are part of what makes the African health profile so difficult. So I think that there certainly is an opportunity, and as the saying goes, we shouldn't waste a good crisis.
You're absolutely right. Thanks so much for your time this morning on the AM Report. It's been a pleasure talking to you and unpacking some of the issues that we face here in South Africa, but on the continent as well. And that's Febe Potgieter Gqubule. She is the former strategy and planning advisor to the AU Commission chair.